Risk factor for cervical cancer. Most commonly, cervical cancer is caused by human papillomavirus 1. Type 6 and 11 causes the condylomata acuminata, that is low risk. Risk factors are multiparity, early age at first intercourse. Third one is early age at first childbirth. Fourth one is multiple sexual partners. Fifth one is lower socioeconomic status. Sixth one is sexually transmitted disease. Seventh one is pre-invasive lesions. Eighth one is OC pill. OC pill only increases using if we use for more than 5 years. It is reversible risk factor. OC pill mainly causes the adenocarcinoma. Smoking mainly only squamous cell carcinoma having the risk factor. Family history is not a risk factor, and early menarche and late menopause is also not a risk factor for cervical cancer. Then peak age of having a cervical cancer is there is bimodal peak. Third to fourth decade is most common, and fifth to sixth decade. Then invasive cancer are human papillomavirus 16 and 18. Then for screening test, we do first we do for human papilloma virus. In that, cervical secretions are picked up by swab and N2 lab. If human papilloma virus is positive, then it is high risk virus. If negative, not infected with high risk. Then in a human papilloma virus, hybrid capture techniques we do by hybrid capture technique. In that, by Kubas test. Kubas test is for strain. Sometimes we use acetic acid 5%. The test name is VIA, visual inspection. Apply acetic acid on cervix. Some places in this condition, some places look pink and some places we look white. White means a dysplastic cell, that is abnormal cell. If we see dysplastic cell changes to white because of increased nucleus to cytoplasmic ratio, then VILI, Lugol's iodine. In that condition, we use Lugol's iodine 3 to 5%. Some areas are brown and some areas looks unstained cell. If area looks brown, that is mature cell have glycogen that takes the stain that turns into brown color. The area that is unstained cell, that is abnormal, that is immature cell having not glycogen that not take stain and turn unstained. Then in these conditions we use air spatula, that is bifid and used to take pap smear at the scamocolumnar junction or ectocervix or transformation zone. From air spatula, put ectocervix, turn 360. How to use this spatula? Put at the ectocervix, then turn 360 degree 4 to 5 times. Then automatically secretions comes on spatula. Then on slide make smear. Then with the help of endocervical brush rolled on the slide on the same slide, then fix the slide, no air dry, and then ideal fixative is 95% ethyl alcohol and 5% ether is ideal. Nowadays we use 95% ethyl alcohol because of safety concern. There is no contraindication for Pap smear. Best time for doing Pap smear is a peri-ovulatory phase. Then a relative contraindication for Pap smear is actively bleeding. Then in liquid based cytology there is one more cytology, liquid based cytology. In that, no slide, directly put on liquid, done even she actively bleeding. Some samples sent for HPV testing and some samples sent for cytology.